right there. Excellent. So essentially that comes down to the realization that certain kinds of social and environmental challenges are beyond the scope and reach of any single organization. And yet, as this slide indicates, there continue to be certain practices that are not allowing or supporting progress to be made in the way that it needs to be in light of persistent and growing social disparities, resource depletion, and certainly climate change. Next slide, please. So around the country and the world, we're seeing growing numbers of organizations that are banding together trying to figure out new ways to organize and deliver resources to meet these challenges. And a number of instances where there's been evidence of success in these collaborations, we see some core and really essential contributors to the success. In more formalized collective impact efforts, these are what show up on your screen now. These 5 elements that initially made the big splash in the Stanford Social Innovations Review a few years back. First element is a common agenda, which can take the form of a common understanding of the problem as well as a big overarching goal or vision for change. It's what really galvanizes and aligns disparate actors. So common agenda being key. Number 2 is shared measurement that helps to chart progress and uphold accountability. So collecting data, establishing a baseline, creating the ability to track progress over time, and again, create mechanisms for accountability. Third is mutually reinforcing activities among diverse stakeholders that are simultaneously differentiated. That is, everyone may or may not be working on the exact same thing, but the idea is that these potentially disparate activities are coordinated and aligned in a common direction, informing one another. The fourth element is continuous communication. Creating platforms for people to find one another, communicate with one another, one-to-one, one-to-many, many-to-many, that support learning and trust building over time. And then finally, backbone support. And this element has gotten a lot of interest, and additional writings have been done by FSG and the Collective Impact Forum if you search online. The backbone support really takes the form of dedicated and sufficiently funded staffing and coordination from some kind of convening entity. The point really being that there needs to be a supported structure to make all of this happen, that it doesn't just happen on its own. Next slide, please. FSG and Collective Impact Forum have also recognized that there are some pretty crucial preconditions for success in these efforts. And those include having an influential champion or champions. So certainly having support for this kind of undertaking, which can be complex, take time, can in many cases try people's patience. So having champions, and especially people who command respect, who also lead with problem solving. A second precondition is urgency for change. The belief that, number one, the issue on the table merits focus, and also the belief that what we've been doing has not been sufficient, so we have to do this differently. And then thirdly, if you click again, is certainly having committed financial resources. Having just been on the phone with somebody leading a collective impact effort this morning, often these efforts take more support than we realize. Next slide, please. So with respect to the structure of collective impact efforts, for our purposes here, I'll just point to 3 of the core components. One we already mentioned, which is the backbone entity in the lower left-hand corner. It's listed here, which can take any number of different forms, from a funder to an existing nonprofit to a newly created nonprofit to a government agency, a school district, or some kind of shared structure taken on by multiple organizations. And again, this provides primarily a coordinating communications function. Secondly, up in the upper left-hand corner is the steering committee, which generally is a broadly representative body of the system that's implicated by the change effort. So it integrates multiple perspectives on the system and provides collectively it provides strategic direction for the effort. And then thirdly, working groups, Working groups, in this case, are comprised of cross-sector partners targeting specific elements of that common agenda. In food systems, that could be food access in one domain, distribution in another, marketing in another, education in another, just by way of example. And these groups design and implement more targeted action plans, often involving non-work group members who do not formally sit on the work group but are part of relevant organizations and initiatives out in the community or region. Some of these groups serve slightly different functions. For example, we see evidence of a funding group, for example, funders who come together to look for opportunities for alignment, or inclusive community networks to raise awareness about and protect certain mechanisms for collective action. So that really is collective impact in a fairly small nutshell, and I'd certainly recommend that people consult the Collective Impact Forum online. There are tons of resources. 10,000 different groups have signed up for the forum from all over the world, sharing stories, resources, and there's plenty to be found there. If we could go to the next slide. The last part of my presentation in the next few minutes, I wanted to just touch on network building and how a number of these collective impact efforts that I've been working with have integrated network thinking and strategy into their efforts. And so by network building and strategy, I really mean focusing on how the overall pattern of connection, how different stakeholders are connected, can shape and lead to more impactful change. So if we could go to the next slide, please. Actually, let's skip that and go to the next one just in light of time. And click again and one more time. So a core framework I use borrows from the great work of Peter Plastrick and Madeline Taylor, who wrote the book Connecting to Change the World. If you haven't seen that, it's definitely worth checking out. And it looks at three different significant ways that networks, that is, connected groups of stakeholders, can create value. One is in the domain of what they call connectivity, where people build relationships and trust and share information, and that in and of itself, creating connections where there weren't, allowing easier sharing of information, can create significant value in a networked initiative. Another in the lower left-hand corner is alignment, where beyond just purely connecting and sharing, network participants begin to align around some common sense of destination, direction, or shared value. So this would be really the common agenda in collective impact terminology. And the last is action, where people formally coordinate around some kind of desired outcome, formally coordinate action. So in the light of time, what I really wanted to focus on primarily here is in the domain of connectivity. So if we could go to the next slide, and one more. What I really want to point to here is the power that building connections between people, and especially between players who don't typically interact and are not typically connected, how that can lead to the kind of change that we had not anticipated. That is, in many collective impact efforts, focuses on formal, coordinated activity among work groups around some kind of officially selected goal. What interests me is, and where I think there's tremendous untapped potential, is in the emergent forms of value that can arise when you get people together and talking. And so people come to a convening, they meet people they hadn't met before, they go off and they start partnering and working together. When that is aligned toward that common goal, that creates a plethora of activity and emergent forms of action and value that I think our challenge is really around just tracking. So I know I have just 1 minute left here. If we could go to the next slide and then go again. One more. We could advance one more. One more beyond that, sorry. So I'm really curious to hear how the collective impact efforts represented on this call will speak to this idea of emergent action beyond their formal structure. But the last thing I wanted to mention is I just can't help talking about the three core lenses that my organization brings to its work around supporting collective impact and collaborative change. We've already discussed networks, but these other two lenses I feel like are critical to this work. And one is uplifting the importance of building power, paying attention to power, pursuing equity, ensuring broad-based inclusion, given that exclusion is often the root of a lot of the problems that we're setting out to solve. If we could go one more slide, it's one reason why we integrate certain kinds of equity assessments into our work, this being an example from Food Solutions New England. And then lastly, last slide, what we call love as a source for social transformation. Sometimes that word love feels a little squishy and uncomfortable to people. But if we really think about the power of when we get to know one another beyond titles and appearances, that creates incredible potential that we see time and time again, that it really be about deepening relationships and the potential that that can create. Thank you.
Thanks, Curtis. So this is Jen from Healthcare Without Harm, and thank you all for inviting us to be a part of this conversation today. I want to start by telling you a little bit about our organization and sort of the big picture of how we fit into the collective impact model, and then I'll go ahead and give a couple of specific examples of our work at the national and regional levels. So Healthcare Without Harm was actually founded in 1996, and we never explicitly really used the term collective impact, but I think from the very beginning we recognized that our success was really linked to that of our numerous different partners, and that our model is really about bringing together the collective voice of the healthcare sector to create change in environmental and human health. Next slide, please. So this slide gives you a little bit of a sense of the big picture of our organizational structure. We're Healthcare Without Harm broadly. We have Practice Green Health, which is our membership organization. And then Healthier Hospitals Initiative is one of our primary areas of work right now that started about 3 years ago. And so these healthcare systems that you see around the border of this slide all came together to identify common areas under which they wanted to work. And so they created this common agenda with goals under each of 6 different issue areas and shared metrics for benchmarking progress within each of those different areas. And so together, these 12 health systems represent over 550 different hospitals across the country. And so clearly together, working towards the same goals, using the same definitions of success, are able to create a change in the way that business is done within the healthcare sector, much more so than even one system could independently. If you go to the next slide, within the overall Healthier Hospitals Initiative, we have a food challenge, and that's where our Healthy Food and Healthcare program lies. And we have about 600 different formal hospital partners across the country, but a network of about 1,000 different hospitals that we work with. And so Healthcare Without Harm, we really view the role of our staff in this Healthy Food and Healthcare program as really as being that backbone support to help these different facilities across the country and within regions identify where their common goals are, where that intersection is, and how we can move forward together to meet those goals. If you go to the next slide, you'll see that this is our general organizational structure. So at the national level, we have a team of about 5 different individuals. And then that trickles down to our regions. And so here in New England, which is where I'm located, we have one regional director, who's Stacia Clinton, and then there's myself and one other coordinator, which both work on a part-time basis. So, I know Curtis mentioned that a lot of times collective impact efforts can be much more resource intensive than people might think at the outset. For us, really resources go to the time, the staff time, and then everything beyond that is around helping to coordinate the efforts of all of our different partners on the ground. And so just to put some numbers to that, In New England, our regional budget tends to be somewhere between about $150,000 and $200,000 annually. If you go to the next slide, this gives you just a sense of some of the different types of entities that we work with here throughout New England. So we have a lot of different, in the 6 different states, most of them are engaged in some sort of food systems plan. So we work with those entities. Farm to Institution New England, which is in itself an entity that embraces this collective impact model. The hospital associations and numerous community partners, which include the hospitals and community health centers themselves, as well as everyone that you can think of across the supply chain, from small local farmers to Sodexo and major national and international food service companies. So our partners really span the whole spectrum, and we really do, nothing would be possible without these partners. I mean, certainly, what's the equivalent of about 2 FTE or 2.5 FTE could not by ourselves do all the work and reach as far as we do with these core partners. If you go to the next slide, you'll see that we really do work to identify explicitly what the shared goals are within each of our states. So, thinking back to what Curtis was talking about with regards to making sure that there's ongoing communication, we do have quarterly work group meetings in each of our states, and when these work groups, about 3 years ago when they were getting started, we brought all of the players to the table and asked everyone to identify where was their overlap in their organizational goals and missions under this umbrella of improving the sustainability of our regional food system. And we identified within that space of overlap, within those intersections, what common goals were to help move us towards improving the sustainability of our food system here in New England. And so that's all put on paper, and I know you can't really read what's on this slide, but it's just to give you a sense that we did do a little bit of that sort of asset mapping and understanding what skills and resources our partner organizations bring to the table, what they get out of being a part of this partnership, and what our goals were to move forward. And we do reassess these work group statements on an annual basis, and sometimes we find that we're still on the same path, and other times we find that we need to adjust because either we've accomplished something or there are new partners at the table that have a different viewpoint or what have you. So if you go to the next slide, I'm just going to give now 3 different examples of how this model plays out. So this first example we call our EdMed collaboration. So we work with, as I mentioned, about 1,000 hospitals nationwide, and Healthcare Without Harm has partnered with 2 other organizations working in different institutional sectors. So we work with School Food Focus, that represents 34 of the largest public school districts across the country, as well as Real Food Challenge, that represents over 360 colleges and universities across the country. And so together, some of the leadership of these organizations met over the course of a year to identify what could we do together to bring together the voice and really the purchasing power of all of the different entities that we work with to create change in our food system. And so right now, our organizations are aligned around shifting procurement of meat and poultry away from conventionally raised products to products raised without the routine use of medically important antibiotics. So it's an opportunity to bring the shared voice of all of these different entities to the supply chain to say that this is something that's important to us and a change that we need to see, and to say that the demand is there, that it's essentially safe for the supply chain to shift, and it's not going to put them out of business, that there will be purchasers there. And certainly No one of our organizations could do this alone, let alone any one of our individuals, hospitals, schools, or colleges. Then if you go to the next slide, this is a more regional example, and again it goes back to the concept of the importance of communication. And so here what we, as sort of, again, that backbone entity, have created is what we call our New England Product Registry. So we have this network, and in New England it's about 150 facilities that we work with across all 6 states, and everyone was sort of independently sort of going through all of the product lists of US Food and Cisco and identifying individual farmers that they could purchase from. And so everyone was having to repeat that process to identify what products are local, how are they produced. And so what we've done here is bring together all of that work that people have done so that individual facilities can enter information for products that are regionally grown or raised and that meet sustainability criteria, and then anyone else can gain access to that information. It's all open access on the website to help with that many-on-many communication to better utilize our time resources in moving forward around shifting what we're purchasing as individual institutions. And even to note beyond that, we are undergoing a very long process of redoing our website, and so we were able to partner with Farm to Institution New England, which is one of our core partners here, to host this on their website. So again, another example of really pulling together all of the common resources for the common good. And if we'll go to the next and last slide, just one more example of how we're sort of working together to accomplish more than we could independently is really around metrics and data collection. And so again, this is a partnership with Farm to Institution New England, where they have brought together a team of different organizations to create a shared metrics project. And so we participate in the leadership team for this project to help identify what are the core metrics to know about farm to institution across the board. And so the different farm to school initiatives, the different entities that are working in the college sector, and then healthcare without harm working in the healthcare sector, are all tailoring our data collection to make sure that we're collecting these same metrics so that we can pool this information to have a greater impact. And then lastly, to help ensure that we can collect better information and that we're not creating sort of fatigue on the part of the respondents when it comes to collecting information from producers or from distributors, we've centralized all of that data collection so that Farm to Institution New England is the one entity that's going out and connecting with those individuals that we want to hear from, as opposed to all of these different organizations going to the same producers and the same distributors time and time again. I am going to leave it at that and pass it along to Ellen Kahler from Vermont Sustainable Jobs Fund. Thank you.
Thank you very much. So go ahead, next slide. So here in Vermont at a statewide level, we are using the collective impact effort, capital C, capital I, the way that FSG utilizes it. And at a statewide level, we have a common agenda, which is our Farm to Plate Strategic Plan. It was something that the Vermont State Legislature requested that we put together on behalf of the whole state. We have Farm to Plate Network as our mutually reinforcing activities, and I'll spend a little time talking about what they're working on. We've developed both the network as well as a very robust website that serves as a platform for our continuous communication across the network. The Sustainable Jobs Fund that I coordinate and run serves as the backbone organization. So as Curtis said, it's not a new entity that was set up specifically to be a backbone. In fact, it was an existing organization that had, and as a nonprofit, we actually have some state statute that governs our organization. So we're an interesting hybrid of being a nonprofit with strong state ties. We are using a results-based accountability framework developed by Mark Friedman as our shared measurement system. And then, as Curtis mentioned, if FSG ever were to expand their 5 conditions to 6 conditions for collective impact, we would strongly urge long-term funding and stable funding, specifically for the backbone support work, but also for the mutually reinforcing activities over time. Next slide. So the purpose of the Vermont Farm to Plate is to enable coordinated collaboration amongst organizations to achieve the 25 goals that are part of the Vermont strategic plan for of Farm to Plate. And also our efforts are to enhance the participation of all of the organizations that are part of the network as well. The 3 overarching outcomes of the Farm to Plate strategic plan that the legislature set in statute are to increase economic development in the Vermont's food system, to create jobs in the food system here, and to improve access to healthy foods for all Vermonters. Next. So once we created the plan, then we needed to have a way of implementing it. And so we looked around the country at other efforts underway to form a network. And so as Curtis mentioned, we're taking a networked approach to the implementation of our statewide strategic plan. Our network is now comprised of over 350 organizations. And what's key here is that it's not a network made up of individuals. It's really, truly a network made up of organizations. They can be in state government, nonprofits, for-profits, capital providers, educational institutions. And all of these folks are working on big projects around systems change within our food system that no one organization could work on or accomplish by themselves. So our network is structured based on again, it came out of the strategic planning process of where the key leverage areas are. The focus of our work happens in working groups. So we have 5 working groups, which are the dark blue circles. We have 6 cross-cutting teams, likely to add a 7th soon. And then we have an evolving number of task forces, which are the smaller bubbles around the working groups. And those come and go over time, and they're very project specific. And then along the bottom there, you can see the Sustainable Jobs Fund serves as the backbone organization, and I'll get into a little bit more detail. But the point that I wanted to make with this slide is that the structure of a network can look any way that it needs to look, and it will never be static. If it's truly a network that is evolving and adaptive, the structure and the different circles on that diagram are absolutely changing on an annual basis. So next slide. One of the things that we've worked hard at within our network is to build a culture of trust and relationships throughout the food system. And that part of that culture is about learning how to share responsibility, share information, really establish and maintain solid working relationships with one another, and to promote learning across the network. We have each of our groups annually does a planning effort to develop their work plan, and so over the course of their year, their efforts are focused on planning, implementing, monitoring, and then learning and adjusting. That reflection annually about how has the system changed as a result of our actions is really a critical part of how networks learn together as well as evolve. And we're really focused on breaking down silos across value chains, across organizational sectors, and across issue or policy domains. Next. So as I mentioned, the network groups that are really the core of the network are these working groups, and those are key leverage areas that we identified. And their focus is to be at a certain elevation where they can be looking at, for instance, aggregation and distribution. What are the needs in order to get more local food into supermarkets or into institutions? Is there an aggregation and distribution function that is not currently being served by the private sector alone, where we need to have some focused activity? So they develop an annual work plan, they look for funding across their organizations, and then with certain types of projects, they'll form a task force. So in fact, we have an independent grocers task force and we have a farm to institution task force, both of whom have their own work plans and report back to their home work group, which happens to be the aggregation distribution working group. So one more click here. And then we have cross-cutting teams, which are operate at a higher elevation than the working groups, and they provide a lot of opportunity for outreach and involvement with specific constituencies. They serve as a liaison oftentimes with the Farm to Plate network and other statewide networks. So for instance, we have a very robust farm to school network that is sort of a network that's nested within the Farm to Plate network, and so we have strong ties and communication there that happen. Sometimes these cross-cutting teams serve as a community of practice where they can be sharing best practices and information across the network and not necessarily take on projects or in and of themselves. So next slide. We do a lot to try to support others' leadership, similar to what Jennifer was talking about. If we had to fund all of the coordination and leadership activities across to pull off the Farm to Plate network, I would have a staff of 15, and I have a staff of 4.4 FTEs. And so we accomplish that by actually having chairs of working groups and cross-cutting teams and task forces, many of whom actually receive stipends to support their leadership. So we don't want to stretch people so thin that they can't serve in a leadership role, but rather we want to acknowledge that they're adding value to the network, they're serving a particular role, and therefore they should be compensated in some degree. The working groups meet quarterly, whereas the cross-cutting teams meet 2 to 3 times a year. Those chairs of those working groups are helping to develop the agendas, they run the meetings, and they are elected by the members of their group. So there's a built-in shared accountability, and they get elected annually for up to a 3-year consecutive term. In the task force situation, a lot of times the leadership actually naturally emerges, and sometimes stipends are not needed, but in some cases they are, in which case we can provide those. We are shifting a lot towards a very project management focus to the task force activities. So there's actually a project charter that they fill out, and it's really about making sure that there's a real need for the task force and that there's a plan for dissolving the task force after the work is done. Next. Yeah. So the stipends, we also provide stipends for farmers, small producers, food chain workers, and others who otherwise would be challenged to attend our meetings, and we set just a standard rate that everybody gets, and people just ask for it, and there's no, we just provide it if it's asked for. Next. As for the backbone organization, the services we provide the overall, we are the holder of the vision and the overall strategy because we were tasked with actually implementing the plan as well as developing it. We help to support aligned activities, so we do a lot of looking at where there's work happening in certain parts of the network that others in a different part of the network need to know about, and doing that cross-collaboration across the network. We provide a centralized tracking of all the metrics and report on progress, both to the legislature and the governor, but also throughout the network. We help to mobilize funding for task force projects and the network needs overall. We help to manage the core communications needs of the network by managing the Farm to Plate website. And we also provide professional development and leadership training for the chairs of the different network groups annually, and that can be either network facilitation training, or it can be project management training, or results-based accountability, outcomes metrics training is what we've done in the past. And then we're also very much engaged in building public engagement. We are just about to launch a statewide local food campaign that will really try to mobilize a much greater number of Vermonters to be buying more local food. Next, please. We have a steering committee which is made up of the Secretaries of Ag and Commerce in our state, plus a representative from our Vermont Food Funders Network. We have a Sustainable Ag Council in the state, which also is governed by statute, so they have a representative. And then otherwise, it's composed of the 5 working group chairs and the co-chair of the Food Access Cross-Cutting Team. We facilitate, meaning the Sustainable Jobs Fund, we as the network coordinator, we facilitate the steering committee meetings. The steering committee decides on and reviews requests for a mini grants Farm to Plate network fund that we have raised funding for to support the work of various task force projects. And then we're doing some things like considering whether or not to expand the steering committee to include other cross-cutting team chairs. And what I think is really important from an accountability standpoint is that all throughout the network, all the chairs of all of the network groups, plus the steering committee, plus the backbone organization, all has an official job description, and we review that annually. And that's really good practice because it helps to keep everybody accountable and keep those organizational egos at bay, because really this is about building something much bigger than any one organization, and it's really about that shared momentum and systems change work forward. So we need to keep those organizational egos at bay as best we can. Next. So this is just a quick snapshot of the budget for my Farm to Plate network efforts. These are not all necessarily things that every collective impact effort needs to have. This is just unique to what we're doing here in Vermont. But just to give you a sense of the scale, we're 4 years into our network, 5 years since we have launched the strategic plan. We didn't have any near way of a budget of this size when we first started, and I didn't have 4.4 FTEs working on this initiative when we first started. So we are building as we need to, and this budget will ebb and flow over time. So next, please. Yeah. So just a couple of quick examples of things that can't be done by any one organization. Our Farmland Access and Stewardship Working Group had a task force that created these 5 planning modules because we're trying to increase the ability of towns to make sure that they're able to maintain working farmland in farming. And this is a series of modules that have been developed to support zoning boards and planning commissions. Next, please. We've been working very closely with Sodexo, and because of the Farm to Plate network activities overall and the strategic plan, Sodexo has really stepped up in Vermont. They have most of the contracts with the colleges in the state, and they have made a commitment to get to 20% locally sourced by 2020. I don't think that would have happened had it not been for the collective combined work that we've been doing together and our relationship building that we've been doing with Sodexo. Next, please. Just another example of a task force, the Food Cycle Coalition we formed. We have a universal recycling law that is coming that needs to be fully implemented by the year 2020, where all organic materials are kept out of the landfill. But in order to do that, it needs to be implemented, and there's not a lot of money from the state to be able to do these things. So a very diverse group of stakeholders have been coming together to figure out together how do we really work to implement this law. And again, this Farm to Plate network serves as a real convening space for very diverse groups to be able to come together and learn how to work together. Next, please. I'll skip that. Next, please. As I mentioned, we do a lot of work around indicators and performance measures. If you check out our website, you can see that we have a whole host of population-level indicators for all of our goals of our plan. Next, please. And just to give you a sense of, on our website, which you can go spend some time on, we are really working hard to track progress over time. And that's really critical to helping keep people motivated to show that this network effort, this collective impact effort is in fact paying off. It also is really important from a transparency standpoint. We really do a lot to share what the data sources are so that people can really understand what's shifting as a result of our activities. Next, please. And I won't go into any of the detail here, but just simply say, you can go to next, that we are providing for the whole network a whole series of graphics on the data that anybody can use in their own slideshows and to understand really what's going on, so that we're actually working on actions that are really going to move the needle, and not just because it was a good idea that somebody thinks it was a good idea that they had, that it's actually based in data, what the data is telling us about the need for a particular effort. Next, please. And I can't reiterate enough what Curtis started out with and what Jennifer has said, and I think what Whitney is going to say. It's really all about relationships. We have an annual gathering every October, and we have about 300 people across the state that come together. This is the one time when the whole network gets together to learn and evaluate what we've done over the course of the year, to celebrate that together. We play hard together as well as work hard together, and it provides a lot of energy and momentum for the coming year. Next. And if you want to learn more about any of the stuff that I've talked about, check out our website. Thank you very much. And Whitney, it's now to you.
Great, thank you very much. So I'm going to talk more from a very localized level of how the Indy Food Council has adopted the collective impact framework. So the Indy Food Council is a collective impact that aims to connect, catalyze, advance, and grow the Marion County food system. So we're very much focused in central Indiana, and most specifically our work in Marion County. However, we haven't always been a collective impact, so I wanted to give a brief history of our organization and how we've sort of adapted to the collective impact model in the past year, year and a half. Next. So this is a showcase of stats and figures and numbers from various organizations that existed before the Food Council was formed that make the case why there's a need for a coordinated body and effort towards fixing our food system in Marion County. As you can see, there's some alarming figures here that we use collectively to showcase a greater need for food system work. Next. However, as we were developing this idea of a coordinated body, we needed a document or a study that specifically laid out the needs of our community and explicitly stated the need for a coordinated body such as the Food Council. So this study was done in spring of 2011 and looked at various food deserts in communities across Marion County, as well as the needs and moving forward recommendations. And one of those recommendations was the formation of a Food Council. So we started with this document as a framework, if you will, to start our work in organizing in the spring of 2011 into 2012. Next. So before we adopted the collective impact framework, we used a very much programmatic approach to bring people together and to start to build those relationships and trust, as all the panelists have mentioned is very important in collective impact. So one of the tactics we used was the Indy Food Fund, which was established in 2012 through our backbone organization, which is LISC. It stands for Local Initiative Support Corporation. It's a national nonprofit that works on community and economic development, and they do a lot of work within communities in terms of funding and community revitalization. So they fundraise for this food fund to bring people together as a framework to start thinking more holistically about food system change for our city. So this essentially was the inception of the council, this organizing group that came together around a funding stream, small grants given out to various organizations that were working on food work within our county. This group formalized in a way that eventually led to an organizing group and later an advisory board. Next. Another tactic that we use in terms of a programmatic approach was establishing an Indy Food Fellows program. So the idea behind this was to bring together higher level educational institutions, students, and local businesses and nonprofits that were doing food work in the community and partnering that match and using this as a tool to bring more people together in different sectors of the food community, and in often cases not the food community, such as universities, and bring them together under a framework to look at food and a food lens for our city. Next. Another initiative that we use as a tool to encourage collaboration around food work was the Fresh Bucks program. The Food Council acted as an incubation space to get this project off the ground. So Fresh Bucks is the city's first SNAP double incentive program. It just wrapped up its second year. We use the connections and the people brought to the table to help launch this in a collective way, and which included grant writing and collective coordination in terms of fundraising. So we helped launch that in an incubation space. It's now housed in another collective impact called the Indy Hunger Network, which focuses on the hunger community in Marion County. Next. So as we were forming, I mentioned the food fund, the review committee of that grant process eventually budded into what would be known as the organizing committee and the board, essentially. So we started slating our board, making sure that cross-sector representation was on the board. We prioritized 4 focus areas of food system work that we identified were very much siloed out, with the intention of breaking down those silos and bringing different perspectives with a food lens to the table to holistically think about food system change. So we brought together players from the community and economic development world, looking at how food can be a tool for neighborhood revitalization and job creation within neighborhoods, bringing together the ecology-focused organizations, local growers, looking at how to sustainably grow growing practices within a city setting. Brought those stakeholders to the table. Again, the hunger and social justice group to the table, as well as public health groups to the table, and all working in a formalized way. Next. So once we got internally our structure, brought people to the table, different sectors, we really wanted to engage the community with the concept of what is a food council, what we intended to do, some of our goals, our vision, our mission, and take that as we were getting that internally structured out into the community for a listening and engagement session. So 2013 was essentially spent taking that on the road, if you will. So we went into communities and talked about what we intended to do, and also gathered information from community members about what they wanted to see in a food council, took that back internally and worked through that. And then in 2014, we're officially ready to launch as an organization. Next. So 2014 is when we came out with Collective Impact. We decided in 2013, as we were organizing, forming, that we, instead of doing nonprofit, we wanted to go the Collective Impact route. So we showcased this at our first annual meeting in the spring of 2014 and explained this concept of a collective impact, which was difficult and challenging at first because it's very much an academic term. We use the Stanford Social Innovation Framework, and it's hard to put that sometimes in layman's terms that, hey, this is the work that we've been doing. We're just formalizing it in a more organized way. So really trying to showcase these great images are from the Collective Impact Forum, looking at sort of before collective impact and after collective impact, and really making the case that before people are granted doing good work, but it's not always coordinated or organized, and they're very much siloed out in their individualized thinking. And the council intends to get everyone in the same boat, if you will, working together, collaborating, coordinating, building trust with each other for a larger vision and goal with our food system in Marion County. Next. So there are various frameworks, as we've heard continually throughout the panel, that are involved in collective impact. And because we are new in adapting this model, there are things that we have achieved and things that we are still sort of working on. So I'll start with what we have achieved, I believe well, would be a common agenda and continuous communication. So common agenda, we achieve this by making our vision, our mission known, and getting everyone to the table to sort of buy into this larger strategy. We've been very strategic, like I mentioned, getting people to the table and aligning behind this greater good, if you will. And then, well, we'll go to the next slide, sorry. So our vision, again, brings in those cross sectors of the food system that we prioritize: so health, nutrition, ecology, hunger, social justice. Next. And then our mission, very much collective impact in nature, showcasing, connecting people, advancing initiatives. So when we established this before we had decided on collective impact, we realized, looking back, this is very much a collective impact mission, and it's very much at the core of what we do. Next. So our initiatives, like I mentioned, are another way to get people together on a common agenda and align work around these three prioritized initiatives. We went through a planning process in the fall of 2013, and through internal conversations with the board, as well as input that we gathered in those community outreach phase, we prioritized three initiatives in which to frame our work. So these are access to good food, expanding the market for local food, and increasing nutrition and cooking education. So we use this as a framework for aligning people within these initiatives, both internally and externally, to advance and move this common agenda and work forward. Next. Another thing, part of collective impact, is reinforcing activities and shared measures. And this is something, as we are newly adopting to the structure, are currently working through how to develop this, if you will. Mutually reinforcing activities and shared measures we hope to accomplish with the establishment of these task force groups. For example, the expanding the market for local food is really looking at currently local food procurement. But before they decide on an action step, they're going and visiting various steps along the supply chain and identifying what those barriers are, and then vetting that information into an actionable step. So, and also part of this task force process is to, within each of those task force groups and that work, cataloging what work is existing in our community and pulling that together in a comprehensive work plan of sorts, so we can see what is already being done, and we're not reinventing the wheel. We're looking at where the council can fill in the gaps and where we can step in and say, this is going on, but this is clearly a gap. So we're going to step in as a coordinating body and advance this work further by identifying these gaps. And then eventually the long-term plan is to develop a comprehensive work plan that showcases food and food system change in our city and aligning it with metrics that we should be measuring to share food system change and how to measure that and tell that story now and many years ahead. Next. Another, we mentioned backbone support. I won't harp on this too much because I'm running out of time, but next slide. And then keep clicking. So our structure, well, go back one, sorry. Our structure, and this would be our backbone structure. Like I mentioned, LISC is the supporting backbone where I work. I dedicate part of my time to staffing the Food Council effort. And in addition, Purdue Extension Marion County has a staff person that's dedicated to the effort, as well as the Office of Sustainability. And we are the staff, if you will, or backbone and supporting backbone organizations. Next. And this is a keep clicking kind of slide. So this lays out a little more of our structure and how we've adapted to collective impact. Like I mentioned, the staff, which is the backbone. We have an executive committee comprised of co-chairs that meets monthly, as well as a few board members. And then we have a larger advisory board that meets quarterly. The idea behind the meeting quarterly is so we can engage them more based on their skill sets with other activities such as a task force group or specific committees like a policy committee and a communications committee that are working to move the council work forward. And then, of course, the community engages in our task force groups. So it's just a visual to show sort of how that all works together. Next. Again, the slide about our board, you can really see how we pulled together different sectors within the local community, from people from growers to community development corporations to public health officials to city officials, kind of all working together in an organized body. Next. And I encourage you to get on our website to learn more about how we use the collective impact framework, more of our initiatives and programs, and of course, any questions, feel free to email me at either one of those addresses there. And thank you for letting us be a part of this panel. I'll turn it back to you all for questions.
Thank you all to our panelists. I did collect a number of questions for each of you. For each of you, and just start off. Maybe there were some general questions about metrics, and that you each could touch on. But one of the questions is, how did you help all the participants buy into the common metrics and data collection? And that was posed for Jennifer, but I think each of you could probably speak to that as well. But Jennifer, perhaps you could get us started.
Sure. So that seems like something we've had to do several times. When we were developing that Healthier Hospitals initiative, it was a little bit before my time, so I wasn't in the room, but you know, the process really was an outgrowth of having identified what the goals and priorities were. And so from there, selecting the specific metrics followed relatively easily, but I will say that the actual data collection is a lot like herding cats, and that, you know, it is something that we do still struggle with getting everyone to sort of submit their information on a regular basis, so that we can really capture what's happening on the ground. The more current example of the work of the Shared Metrics Project, you know, I think the way that we've had success with that is a little bit like how Ellen was talking about how they became the backbone organization, is that there was this process through which the farm to school entities and the colleges and Healthcare Without Harm, you know, we were all saying we want this information, how can we get at it, oh, wouldn't it be great if, so it was sort of this natural evolution that there would be sort of a unified process for collecting that information. And then it was, you know, definitely was a lot of sort of sitting around the table and saying, well, this is what's important in my sector, and this is what's important for my organization. And so I will say, while a lot of the metrics are uniform, for example, Healthcare Without Harm, so we've agreed when we do our annual survey of our hospital partners, we have agreed to about 5 or 10 different specific questions that we will ask, but then we also ask additional questions that are specific to our work and some of our campaigns that diverge from the main goals and focus of you know, Farm to Institution New England overall. So there's some flexibility within that. I hope that answers that question.
Thanks, Jennifer. Ellen, perhaps you could touch on that too and say a little bit more about the results-based accountability as a shared measurement. People were interested in getting a link to more information about results-based accountability.
Sure. So Mark Friedman is the fellow that created it. So if you just Google results-based accountability, that will come up, but we can provide the link as well. The thing that we like about it is it's fairly elegant in that you ask there's 2 levels to it. There are population level indicators, which are really coming from official data sources, federal and state data sources. So they're the really big areas like obesity rates in the United States, or environmental impacts on certain types of farming practices, for instance, or, you know, big things that, again, no one organization is going to be able to move the trend line on that population level indicator. But the theory of change is that in a more aligned, collaborative, networked approach, we might be able to actually have an impact on that trend line. And that was why I showed that graphic about the numbers of jobs within the food system. Again, that's a population level indicator. No one organization is going to move the needle, but collectively we are moving the needle. And then so the Sustainable Jobs Fund is the backbone organization. The population level indicators we've created connect to the 25 goals of our strategic plan. So they they are, in some cases, multiple indicators that triangulate in a way that give us a sense that we are moving the needle on a particular goal that we've set out for the overall effort. And then on the individual organization level, you have these things called performance measures. And so any particular organization within our network can answer, they have their own set of programs. Individual businesses have their own agendas with their, what their business is about. And so they can ask the question, what did we do this year? How well did we do it? And is anyone better off? Is the network better off? Is the food system better off? Are our constituents better off? Are low-income Vermonters better off? So whatever the focus of your programmatic agenda is, having you decide what it means to be impactful, and you can develop your own set of internal metrics, whether through surveys or the way in which you collect data, to give you a sense of how your program is performing. But again, that is for the individual organizations within the network to be able to do for themselves. The theory is that by all of these organizations having their own performance measures, that it will have an impact on the population level indicators. The one last thing I will say about it is that what we're working now on is getting all of our task forces and working groups and cross-cutting teams to have their own performance measure for the purpose of their group, so that every year they can reflect on, is it still worth that we're meeting? Are we actually, is what we're doing here together matter, and what are we ultimately trying to, are we actually moving the needle on some of our larger population indicators? So hopefully that answers the question.
Thanks, Ellen. And Whitney, there was a specific question for you about metrics. How did you benchmark the 3 initiatives for the Indy Food Council?
Sure. So they came out of a planning process in terms of what to prioritize, and we're currently at the point where we're working to assign metrics to those. So those individualized task force groups are working on identifying work plans and action plans. So I would say we're very much early in the stages of that, of how to adopt our vision, our mission, our goals to in a tactful way in terms of action steps to a work plan and initiatives. I will say that as part of our food fund process, we have metrics that each of the grantees report out on, and so we're working to sort of bridge that with work plan metrics measuring those 3 initiatives.
Thank you. I'm going to move to some questions about communication, and one person asked they've said that they've found basic communication to be challenging, and they would like for each of you to discuss the techniques that you've used to improve communication at all levels among directors, program staff, etc. And if you can include in that maybe some specific examples of software products that you use to communicate between the directors, the program staff, and the public, that would be helpful as well. And I will, again, start with, Curtis, I don't know if you have anything to share. Maybe you could touch on what some of the different groups you've worked with have used, and then we'll move on down the panel.
Sure. Well, I'll just say that is it's a great challenge, definitely, and I think that the key is not to rely on just one mechanism. I think there's good experience and research that shows that having sort of a matrix of different ways for people to find and communicate with one another is the key, just given different people's comfort level and proclivities. And again, different mechanisms for people to find each other one-to-one or one-to-many or many-to-many. I'll definitely leave it to the panelists to say more about their specific examples, but I will say that I'm working with a few different groups on the potential of creating these more integrated platforms, collaborative platforms, where you can have multiple channels kind of aggregated in one place, and also where there's a place that people can more readily generate content that gets shared with the full network. I think there's plenty out there, sort of social media enabled, Web 2.0 enabled, that's interesting to explore.
Thank you. Jennifer?
Sure. So, I think like Curtis was just saying, we do try to sort of change it up. in each state, our work groups meet on a quarterly basis. But we do alternate in some instances between doing those meetings in person and holding them virtually. We try to vary, the time of the day that they happen because, everyone's schedules are different. So for some people, morning work, some people afternoon work, some people can never travel. So, varying things up along those lines. And then we use sort of standard communication strategies. We have we have listservs where people can share information, with our core community partners and with our individual hospitals. As an organizer, I try to make sure that I do individual phone calls to check in with everybody at least once a year, so that no one totally sort of falls off or gets lost in the shuffle, and we understand sort of the individual circumstances. And then, we really try to make the most out of the events that are being organized by those partner organizations or other relevant organizations that are working on similar issues. And so we try to sometimes piggyback meetings on conferences where we know people will be attending, or encourage our partners to present at different conferences to share information that way. Things along those lines, standard newsletters, things like that as well.
Thank you. And then Ellen, could you speak to, there was a question specifically about the software that you use to communicate between your project partners and the public. Could you touch on that, please?
I'm not exactly sure what that's referring to. The Farm to Plate website is our communications platform. So for all the network groups, there's a listserv function in there that is password enabled, meaning that only the people that are actually part of a Farm to Plate network group can send an email to one another in the listserv function. But anybody in the general public can see almost everything that's on that website, and can access it. We do have a monthly newsletter that goes out to a list of about 4,000 people at this point. We are planning to do a local foods campaign, and maybe that was part of the question, and that is still just under development, but it'll be a very grassroots, very social media heavy, oriented buy local type campaign.
Okay, great. And then I think we have time for one more question, and this is more about the composition of the work groups that many of you all talked about, and how do you decide on the composition of those work groups, and do you have signed contracts or agreements that you have the participants sign when they join a work group? And whomever would like to take
this is Ellen. We have a network pledge, so organizations sign the pledge, a very simple pledge to join the network. The people sign. They vote with their feet. They show up at meetings. So we take a look at, just make sure that we're not missing some key constituents or key stakeholder groups, but otherwise we pretty much let people self-define what groups they want to be in.
Anybody else?
Yeah, this is Jen, and for us, our work groups are a little bit of a mixture. So typically we have anywhere from 1 to 3 lead partner organizations in each state that we do have an actual formal MOU with, and they sort of take the lead on coordinating and setting agendas for those work group meetings, and helping us keep sort of the pulse of what's going on in the state. And so it is slightly more formal with those sort of lead partners in the state, in each state. And then beyond that, it's basically everyone is welcome. It tends, in our case, to be mostly food service directors, and then we invite individuals from all across the food system to come and do different presentations at different times or things like that. But we've never turned anyone away.
Well, thank you. I think that we've got a number of other questions that we don't have time to answer today, but we will share your questions with the panelists and then get back to you with the answers. And with that, I'll turn it over to Anne to close us out.
I just want to give a big thanks to all of our presenters today. It was really awesome, and we will be able to send this out tomorrow. We'll send out the webinar minus hopefully some of the technical difficulties in the beginning. Thanks to everybody who participated, and we look forward to hearing from you on our next webinar. Goodbye, everybody.
Bye, thank you.